I'm here with both Bonnie Michelman, who is the Executive Director for Police and Security, and Dr. Paul Biddinger, who is the Director of the Center for Disaster Medicine. And they're going to talk to us about the change in the way that we describe codes in the hospital. So, Bonnie, why did we do this?
I think we did it to help with clarity in many ways. Employees that were working at different partner sites were confused because some of the same codes had different colors associated with them. We did this for our visitors and patients so that when they heard an overhead announcement or a page, they would understand exactly what was going on rather than assume something that wasn't the case.
Right.
And thirdly, we did it for our outside agencies. Our law enforcement partners, for example, asked us to use plain language when describing a particular security event, perhaps an infant abduction or something like that, rather than using a color which they don't know.
That makes a lot of sense. Paul, what does this mean for Mass General employees?
So the good news is that for the most part, Mass General employees' daily operations aren't going to be affected. We're not changing what we do with specialty teams, so the Code Blue, the medical response emergency teams, will operate the same as they have been. But if there's an event in this hospital that people need to know about right away, a security event, a fire, a severe weather event like, say, a tornado in our neighborhood, they're going to hear about it on the overhead system with plain language, and they won't have to worry about what the color code means or try and think about what it might mean if they're trained at a different institution or work at a different institution. What we do want people to remember is that if they hear of an emergency event, they should follow the instructions that are coming over the page or the email or other employee alert system. And we want people to actually sign up for the employee alert system. So what this means is that you should go into your own listing in the partners paging directory, make sure your cell phone number is listed there. That's how you'll receive a text alert, a phone call alert with your phone on you. You can make that text, your phone number, confidential in the partners paging directory, but it's the best way to make sure you get access to information when we use the plain language if there's something immediate that you have to know about right away.
Great. Bonnie, Paul, thank you both for working so hard on this really important work.
Thank you.
Thanks.